This episode of the podcast is brought to you by Branding Isolate. The CBD industry is booming, and more products are hitting the market. This means that making your brand stand out from the crowd could be a challenge. Luckily, the team at Branding Isolate has you covered. Branding Isolate is a branding agency armed with almost 2 decades of experience in design, branding, and website development. The team has made it their mission to ensure that your CBD or wellness brand sells, connects, and succeeds. So if your CBD business is in the market for logo design, brand strategy, package design, product photography, website design, or website development, call them today at 832-379-8978 or visit their website at brandingisolate.com. Branding Isolate. They handcraft brands that sell, connect, and succeed. Hello, my fellow people of the plant. Kevin Carrillo here, and welcome to another episode of the Cannabinoid Connect podcast. My guest today is Kim Stuck, founder and CEO at Allay Consulting. Hello, Kim. Thanks for joining us today.
Hi, thank you for having me.
I love your background. For those who are listening and can't see, she has this. Are you in the woods? Like, where are you based? That out the window looks so green and luscious. It's beautiful.
Yeah, so I actually relocated last December. So I've been here for a year to Oregon. We actually opened a new office in Portland. This is we are building a house right now. So this is actually my trailer that I'm working out of. This is my office now because I had to be away, from other people. And yes, we back up to the National Forest, Mount Hood National Forest. So it's gorgeous. I love it.
Wow, where'd you move from?
Colorado. I'm originally from Loveland.
Okay, got you. Yeah, so the weather, I bet, is much warmer than Colorado winters, I would imagine.
Yeah, I don't really miss the, -10. I think it's actually really nice there right now. But yeah, I mean, it's a lot nicer. It's green all year long. So it's definitely a change.
Awesome. Well, congrats on the move, and you're in the right state in terms of cannabis consulting and compliance. And so I'm excited to talk to you today because compliance is an issue that we've kind of touched on, but we really haven't taken a deep dive into. So for those listening, as I mentioned, I have Kim Stuck on. She's the founder and CEO at Allay Consulting. It's a compliance strategy and services provider serving the hemp, cannabis, and psilocybin industries nationwide.
Yes.
So
yeah, we actually just started the psilocybin side this month. So it's pretty exciting for us.
awesome. So yeah, I want to put that on the back burner because we're definitely talking more about psychedelics and the psilocybin market. So really interested to talk about the compliance there. But before we dive into Allay Consulting and the great work that y'all are doing within the industry, why don't you first, Kim, give us a sense of your background and what, kind of push you to make this transition into cannabis?
Yeah. So I actually, like I said earlier, I'm originally from Colorado. So I grew up in the state that legalized, recreationally first, which was really exciting. It's definitely a part of the Colorado culture, that's for sure. And so I originally started in the cannabis industry as a cannabis regulator. So I worked for DDPHE as a restaurant and wholesale food manufacturing health department inspector, which is kind of a weird job to begin with. But then, when it became recreationally legal in 2014, we really realized that somebody needed to regulate this and be in there and make sure that people are following the rules and washing their hands and putting the right ingredients in things. And so I got involved, they kind of asked me to be involved. And so I started doing that. I was the marijuana specialist there for a little over 3 years.
Did you have any experience with the plant before that, or was this like a whole new world that they just kind of threw at you and said, here you go, good luck?
So I grew up in Colorado. So I can't say that I ever grew or anything like that, but I was very into the culture already.
Sure.
And my that's just the way it goes. And so, when I became a health department regulator, I came from bartending, I wasn't anything special. But once I took on that role, I didn't know anything about extraction. I didn't know anything about how to grow it correctly. And so really it was a huge learning curve. And thankfully back then people were so excited to be regulated. They were just so excited that they were legal now and they could have this as their job and actually make a living and, that kind of thing, that they would just welcome me in and be like, come here, I'll teach you everything. Come see all the cool stuff. And it was
So
great. It was
it was
great.
it was almost opposite from like mature industries, like you said, the restaurant, the bar scene, where when regulators come in, it's like, uh-oh, SIS, we got to make sure that everything's compliant. Okay, here. But with cannabis being such a new industry, like you said, these people were just excited to be legitimate at this point, right? So that must have been a nice kind of change.
Yeah, yeah. And after so long in restaurants, I'm a person that thrives in change. I like learning new things. I was so excited to get involved in the cannabis industry because it is completely new, and learning about the cannabinoids and the cannabinoid system and understanding extraction and all the different things that you can do and how to do it. And, I learned so much, especially since was in every single place. I did all of their licensing. So I saw every single different company in Colorado, at least in Denver County, all of their processes and everything. So I learned a wealth of knowledge just being in the industry. And then eventually I fell in love with the industry, which is easy to do because the people in this industry are awesome.
Absolutely.
And yeah. And so I was like, I need to be better. I know I can be better for this industry. Because as a regulator, you can't really help people very much. You go in, you tell them what regulation they have to abide by, and then it's on them to figure it out. I'm not allowed to give them advice. I'm not allowed to say, you just have to do this and that's it. And then they do it. It was a lot more complicated than that due to like liability issues. And so as a consultant, that's your job. You are there to give them your opinion and tell them, hey, these are your three options. This is what you can do. And that was a lot more helpful to the industry. And so I started my own company in 2017, decided to go for it.
Awesome. Yeah. And as a like wearing just that regulator hat on, I would assume you're not able to give that kind of advice because there's a conflict of interest, right? I mean, I would imagine you're working for the state in that role. So any kind of recommendations to use this service or follow this, it just wouldn't be good because of that conflict of interest. Is that right? Or
Yeah. And also it makes the state or city liable. So if I gave the wrong advice, like right now, if I give the wrong advice, I have insurance, right? Like I would fix that problem. We would figure it out. If it costs them money or something. I mean, that's what consultants do. When you're a regulator, if you give them the wrong advice, they can sue the city for what you said, and it's not on the regulator, it's on the city. And so you're really guided not to do that. They even told us in training, like, that's what consultants are for. You do not give advice, you do not tell them how to fix the problem, you just say that this is what you need to be comply with. And then if they want to hire a consultant, they can.
Right.
And I was like, oh, okay. And then I was like, well, I just need to become a consultant. Yeah.
Yeah, that was the light bulb moment, it sounds like, right? You're
Yeah.
like, I want to help. I want to do more than just kind of tell people what regulations or compliance they should abide by. I want to go that extra mile. So that was kind of the inception of Allay Consulting, or
Yeah. So, I mean, there was a few aha moments, but that was it. Exactly. I wanted to do a little more. There were a lot of people that I was fining and disposing like millions and millions of dollars worth of product. It was heartbreaking.
ooh,
It was
tell us stories.
heartbreaking.
Tell us some juicy stories. What are nightmare stories in terms of like product recalls or something like that?
Okay. Well, I have a lot of stories because I performed a lot of recalls. In fact, in 2015 alone, I disposed of $28 million worth of product in just Denver County alone. I put a lot of places out of business. They came up with a really awesome nickname for me and everything. So
What
people knew who I was,
the
knew what I was doing.
the assassin? What was it?
They called me the weed whacker in Denver. It's terrible.
That's actually kind of
Uh,
cool. I should own it. That's kind of cool. I don't know, but
but yeah, so anyways, so yeah, I mean, one of the biggest recalls I ever did was actually because of well, it was a pesticide recall. So in 2015, the laws changed because they realized that cannabis growers were using pesticides that were actually carcinogenic. And instead of it just being on the plant and then dissipating or disappearing by the time it was in product, we realized that the extraction process actually increased the amount. It actually extracted from the plant. So like any pesticide was like tenfold higher in like a concentrate. So I was finding concentrates with like myclobutanol or spiromethicin, sorry, can't even talk today, at like 50% in a concentrate. So yeah, so there's like more toxic in there than THC, which is not a good thing. And that in your lungs can definitely cause cancer for long-term exposure. So, so we did all these recalls, and I tracked down these certain concentrates that were very high, and we found out that there was an extractor who was taking, all kinds of different people's product and extracting it and then giving it back to them, right, as concentrate to sell in their dispensaries. Well, this particular person was not cleaning and sanitizing his equipment at all. So he had one grower that, out of the 20 growers that were giving him product, one grower was using, toxic pesticides. But because he wasn't cleaning in between different runs, every single person's had to be recalled. In fact, he contaminated everybody's.
And that process, while it can be very it's a lot of work, right? Every time. It's so important though. It's so needed because of that example that you're giving right there, because those mycotoxins, those carcinogens could get mixed into the next batch, right? And it could just kind of further destroy the products that you're trying to produce.
Yeah, and it was so sad because so many of these growers and dispensary owners, they didn't do anything wrong.
Right.
And here they were. I mean, that was one of my biggest recalls. And it was so sad to watch. And they just like didn't understand, like, what did we do? And it was like, well, that's the problem, is you got to check out who else is working with you and white labeling or doing whatever, because if they're doing something, it comes back on you because you're the owner and it's your label, right? It's going to hurt your brand.
It's that ripple effect. Yeah. That makes so much sense. And so were there any lawsuits that were filed against that particular extractor? Or was there no kind of legal recourse that took place?
I'm hoping that there was.
Yeah.
But I honestly don't know. As a regulator, we don't really find that kind of stuff out unless somebody reaches out. And even when I was working for, the government, they wouldn't allow you to be involved. So even if they wanted me to be a witness on the stand or something like that, they could only use my reports that were public. So I honestly don't know. But I do know that there has been a lot of lawsuits for that same thing. And with the way that things are going and the lack of regulation when it comes to health and safety in the cannabis industry, I can imagine that there is a whole lot of those kinds of things that'll happen.
Right. Yeah. I want to touch on one other point. Wearing this regulator hat that you wore until you started your consulting firm in 2017, and that is, I would imagine that you touched the different verticals in the space, right? So you mentioned cultivators, you mentioned extraction labs. How about testing labs? Did you do any regulation and compliance around testing labs? And if so, kind of what were some key learnings that you found there?
So we worked very closely with testing labs because all of our investigations, we'd have to send samples to them. And like work really closely with them and figure out their processes and make sure that they were legit enough for us as a government body to be using their testing lab. And we didn't actually directly regulate them. That was left to CDPHE because they were the ones that actually, and MED, who actually licensed them. But all of them at that point were ISO certified, which is really good. But different testing labs, I mean, as we all know, have different levels that come out. We've sent exact same samples to different labs and gotten different results. The problem that we've run into, at least in Colorado during that time, was we just couldn't, it all depended on, what process they used. Each one of them uses kind of a different process to break everything down, and different machinery. And some of them are even testing to different levels, and percentages and things like that. I am not a testing guru, so I don't know all the technical terms, but yeah, there is a lot of problems when it comes to the consistency in testing and testing labs. And that isn't just in like 1 or 2 states. That's every single state that we work in. It is like crazy. And I wish that at some point we could figure it out.
Yeah, you touched on exactly what I was kind of getting at in that, like, there's this notion of lab shopping, right?
Mhm.
And getting those higher potency tests because you know that particular lab is going to do you a favor, and and it's weeding out the good actors, the people that are trying to do the right thing and play by the rules, so it's interesting that you say that it's not just a state issue, but it's happening nationwide.
Yeah. So what I'm hoping is, and this is already happening on the hemp side, because we also work with hemp clients as well. But when the FDA starts coming in, and when the federal government starts getting involved, a lot of those standards are going to be set nationwide. At least we're hoping. Um, yeah, we'll
Fingers
see.
crossed. Yeah.
We're hoping, from what when I've talked to the FDA, that they are thinking about that and it is on their mind, which is a good sign.
Yes.
Obviously, with the THC industry, that's a little farther out from legalization federally. So we'll just have to see, how long that'll take. But I know that there are some states that are coming online, including like Illinois. They've realized this is an issue, and they're trying to take steps to solve it. So hopefully a state will get it right, and then other states will adopt that same process.
Absolutely. Yeah. I actually thought of one more topic with the regulator hat on, and then we'll switch gears. And that is retail shops. So we've talked about on this podcast the importance of shelf life, right? When it comes to products, and how the efficacy of the product could be lessened if it's on the shelf for too long. So is that part of what you did as a regulator to ensure that these products were on the shelf in a window in which they were the best?
Yeah, definitely. So if we were in a dispensary and we noticed that there was something that was expired on the shelf, we would have them remove it. And that is a violation in health code. And that's even FDA as well. You're not allowed to sell expired goods. Back then, they were not requiring, in any state that I know of, a shelf life test. And shelf life is very different than shelf stability. So shelf life is how long can it sit on a shelf for before it needs to be sold. Shelf stability is it able to sit on that shelf, not in refrigeration, and still be safe? And in Denver County and in certain counties in California, Nevada, they're requiring this thing called shelf stability approvals, which is essentially a health department evaluates your process and sees if you have like a heat step, or if the pH and the water activity are at certain levels, to make sure that something isn't growing in your tinctures or oil or something like that. And the one thing that they're really trying to fight against is actually botulism, Clostridium botulinum, which does grow in that anaerobic environment without oxygen. So tinctures are like a little dangerous when it comes to that stuff. So you have to do some kind of pasteurization step, or you can just keep it refrigerated. But some people don't know that, but it's a big deal in a lot of counties right now.
Yeah, absolutely. It's something that, like, you don't really, I mean, of course the shelf life, you think about, that's common sense. You don't want to sell products that are expired, but shelf stability, that's a whole other topic, right? That operators need to focus on to ensure that their product is saying what it'll do, you know.
Mm-hmm.
So let's switch gears a little bit, and let's talk about just someone entering the cannabis industry today, right? I want to start a cannabis business, and we know, like, the money, right, that's involved in terms of licensing, the red tape, the different things that you have to deal with from the regulation standpoint. But when it comes to compliance, both federal and local and state, like, what should these new entrants think about before even launching a cannabis business from a compliance perspective?
Well, so we work with several different types of clients. We work with clients that are brand new. We work with clients that are 10 years, 15 years old sometimes. And what I've learned is if you're starting a business and you make compliance a part of your culture of your business, long term, you work out a whole lot better. And you don't have to change things down the line that could be problematic. It's hard to do that, as a whole company. So most of our clients that start out, they automatically want to just become GMP certified, which I think is one of the best things that you can do in the industry right now, because it's so underregulated when it comes to health and safety. In fact, so many consumers will only buy GMP certified products, and so many people who are creating products will only buy oil that is from a GMP certified, facility now. That's the trend that's happening, which is great for health and safety, and it's going to make our products so much better. But at the same time, there is a price with that. And there is a dedication to it. You can't just like, oh, whatever, we'll see what happens. Like, no, it's a little bit of work and a little bit of time, and that's
Right.
okay. But yeah, most of my clients are going directly for GMP. So we do like an entire evaluation of their facility. We help them with their build out to make sure that the physical facility is GMP compliant and can be GMP compliant, because a lot of the facilities that I go into right away, I look around and I go, oh my gosh, if I was an FDA agent, I would close you right now, because it is not, and it can't even become GMP compliant because, they don't have enough rooms or hand sinks, or there's carpet on the floor, or it's wood, everything's wood, or, whatever it may be.
Right.
And it's just like, it's crazy actually. um, but but people are working towards that. So we usually do that. And then we immediately, all of our clients are on retainer, and we just set out that entire like month by month plan on how to get them to GMP certification. We help them find their certifying body that they're going to work with. We work with 6 of them now as their consultants. And it's a really great way to start. And
Yeah.
then, and then if an FDA agent comes in at any point, the GMP certification is based on those FDA regulations. So you should be fine. And it won't be as scary when the FDA starts knocking on your door.
And it seems like taking that path to be GMP certified is also being proactive, because eventually when the FDA does implement consumer oversight for, CBD and other products,
Mhm.
you're already ahead of the game, right? You don't have to like play catch up.
Exactly. Yeah. And that's what I try to push. It's easier to do that. We can also do audits to just, FDA 111 and or 117 and, get you compliant. But when you have the actual certification, I mean, you can show that to people that you're selling their product to. You can put it on your website. I mean, most people, really appreciate that, because they know that it's a standard that exists in all other industries. It's not something new or different. It's just saying that your product is safe. And then after that, usually we go towards ISO 9001 and then ISO 22000. And ISO 22000 is what you really need if you ever want to sell in an international market. And I know that right now that isn't maybe on people's minds, but the people that are thinking about that now are going to crush it when it becomes open to international market.
Again, just being proactive, getting ahead of what's to come. That makes a lot of sense. As an owner of a compliance firm that specializes in hemp, cannabis, and psilocybin, what would you say is the most regulated aspect of the industry?
The most regulated?
Right.
So definitely the THC cannabis side, simply because they have a state regulatory body, right? That you have to deal with. So in Oregon, we have the OLCC, and and on top of that, they should be aware of OSHA and FDA and fire code and all that. Whereas with a hemp company right now, they don't have any of that yet, which is kind of interesting. But most of them don't even have a health department that comes in. In fact, there's a lot of cannabis companies that don't. It just depends on which state you're in. But they don't. They're completely unregulated, like 100% unregulated, except for maybe their licensing board, their excise and license. So but they're going to have to deal with the FDA any day now.
Right.
Once the FDA, they're writing their regulations right now. They said they were going to be out 6 months ago, but COVID kind of slows stuff down. But eventually those regulations are going to come out. It sounds like they're going to regulate very similar to FDA 117, and then have like their own chapter of like, this is cannabis, and how, because there's variances, there's different things about cannabis than every other industry that you have to address when it comes to health and safety. So yeah, I mean, I think that the right now it's the THC cannabis side. Hemp kind of is on the back burner, but they will be regulated federally soon. And then with the psilocybin thing, I mean, those regulations haven't even been written yet. They're actually going to be working on those. That's going to be regulated by the OHA, the Oregon Health Authority, and they're putting together a group of industry and like doctors and scientists, and they're going to build the regulations from there. So we'll see how regulated they are. I don't know how it's going to go.
Right.
But they will be regulated to that sense. But once again, they won't have to deal with any federal for quite a while.
Right. And that for psilocybin, that regulation that you mentioned, is that specific to just Oregon, right?
Yeah, so it's only a state ran
Right.
thing.
Yeah.
And it's medical only, so it's a therapeutic, right? So it's going to be very different than, what it looks like for medical cannabis. And I think they did it that way just to see, if the sky was going to fall, and we'll see what happens. But I have a feeling, once one, and we've seen this in the cannabis industry, once one state goes on board and they show that it works and it's helping people, states will start doing it all over. And I think eventually we will get to a spot where psilocybin will also be federally legal for recreational use.
Yeah, I totally agree with that also. I mean, I've had guests on that just share their stories of using psilocybin or ibogaine or these plant-based medicines that help with addiction, mental illness, all PTSD, all these different things. And it truly is fascinating to hear firsthand their experience and how it truly did help them and improve their life, as opposed to some of the pain management stuff that we're used to in the pharmaceutical side. So
Yeah.
it's very interesting to see, and it's big. It's a smart move on your part, Allay Consulting, to focus on psilocybin as well, because that is going to be the next kind of therapeutic medicine.
Well, and actually, it rolls right into our wheelhouse. We work with good agricultural practices. We understand all of the regulations for regular mushroom growing, which we're just going to apply to this industry. Obviously, there's going to be packaging issues and labeling and all of that. And dosing is going to be a big thing in like the manufacturing facilities. But for the most part, we can take already existing regulations just the same way we did with cannabis and apply it to this industry. You just have to use common sense. And the good thing is my entire team are ex-regulators. And so they have that eye. They know, hey, this is what they're going to regulate. This is what they're going to do. This is how they're going to do it. And if something changes, we can change with it. And so we're really hoping that we can help that industry just as we have other industries.
The A team, the Allay Consulting A team. It sounds like that's
Yeah,
awesome.
I love my team. That's for sure. They're awesome.
How much interaction do you have with the FDA, like if at all?
So, I mean, we call them pretty regularly. So when we worked as regulators, when you work for a local health department or a state health department, if you have a question about something, you call the FDA, and they're the ones that has the authority to give you, jurisdiction, right? So, so when we started cannabis, I mean, I used to call the FDA and they'd hang up on me because they didn't want to talk about cannabis. Now they're calling us and having us educate them. So it's really been interesting to watch.
That's encouraging. That's encouraging that they're reaching out also, though. That is good. That's a good sign.
Yeah. I actually did a roundtable with them and some other accredited certifying bodies. ASTM, I'm on the ASTM board as well. And BSI was there. And, there was a couple FDA agents there. And it was really exciting because it was pretty much 2 whole days of me just, these are the issues that you're going to run into. This is stuff that, because I had already been through it. I had written regulations, health and safety regulations, and we screwed up quite a bit because we did not understand cannabis. We didn't understand what the processes looked like. We didn't understand what dosing was about. We had no idea people were using pesticides. We didn't think about heavy metals. We didn't think about mycotoxins. Like, it was crazy, the things that we had to backtrack on and be like, oh God, we got to fix this.
Right.
And I'm hoping that they can learn from us and not do the same things, because
Yeah.
on a federal level, that's going to be ugly.
Yeah, I love that mindset. I've echoed that as well, specifically for the cannabis industry. In that, while the industry is kind of being divided, you've got your THC cannabis side, you got your hemp, right? And it's important that those groups still learn from one another and kind of don't just go off and part ways, right? Because a lot of those key learnings can be applied. And just like you're saying for psilocybin, I mean, it's the same kind of wheelhouse, obviously a different plant, different effects and whatnot, but overall there's still some key learnings that can be applied, and that's good that you're thinking that way. It seems like it'll kind of help move the industry a lot faster, as opposed to waiting and trying to figure it out from scratch.
Yeah, reinventing the wheel is never, if you can use something that is already put together, you should. Obviously there will be new stuff that we'll have to write. Psilocybin is a whole new thing. And with cannabis, it was the same way. But, food safety is food safety. Public health is public health, and if you just have to look at each situation and evaluate all the things that can go wrong during that process, and then write the regulations based on that. But you have to understand the process before you can do that. So you have to actually know about the plant and the processes, and how the industry works. Because when I walked into my first extraction lab, I had no idea what I was looking at. It was so overwhelming. And I don't want other regulators to have to feel that way, because it's very hard to regulate something that you don't understand at all.
Right, and that is the unique position and the great position that you're in, and your company Allay Consulting is in, because you do have experience with the plant, right? You have walked through those facilities as a regulator. You've learned about the equipment. You've learned about the various processes. So now you're better positioned to give informed insights that really can help move the needle. And so let's talk specifically about Allay Consulting. So why don't you tell us a little bit about the firm, and what your business strategy is and what your goal is for this year.
So we started off in Denver, Colorado. It was just me all by myself. And I really just wanted it to be me in the beginning. I didn't think that we were going to ever expand or do anything too crazy. I just wanted to pay my bills and do something that I loved. But I ended up loving it a whole lot and being very passionate about it. And so therefore, I think that when you're passionate about something, stuff just grows for you. And I got super busy, ended up having to hire, and I hired, my first person in 2018. And then, it just kind of went from there. We kept getting busier and busier. We actually work in all 50 states now. It was just a Colorado business in the beginning, but most other states that were coming on board needed the same stuff, right? And we deal with mostly federal regulations. So those are the same in all the states. And so we kind of expanded. And then Oregon, obviously I've been thinking about psilocybin for a long time, because I saw the writing on the wall. I knew that was going to be the next thing. So we started doing research really early on. In fact, one of my consultants, Kelsey Hanley, she really knows a lot about psilocybin. That's like her passion, is that whole industry. So she's helping me a whole lot build out that division. And then, so Oregon, we had so many clients in Oregon, and were paying for us to fly out every time. And so we decided, let's just open an office there so that we have a couple consultants there and make it, less economically,
Right.
crippling to the people we have out there. And so that was our initial thing. And then I was like, oh, psilocybin's on there too. It's just a perfect opportunity. So my husband, thankfully, was on board, and we moved to Oregon. And so far it's been great, but that's kind of where we're at right now. I don't know, mostly even before COVID, we were, we could work anywhere, because we're on the road most of the time anyway,
Right.
going to different places and, writing reports and stuff in back rooms of grows constantly. And so, it wasn't hard to go remote when COVID happened. And now I'm like, I don't think we even need an office anymore. So, we can kind of hire consultants in any state that we want, kind of go wherever we want and see what happens.
Yeah.
But for right now, we're just trying to keep the wheels on during COVID, and try to help as many people as possible, get into as many places as possible before those federal regulations come in. And right now, I mean, obviously, I love the THC cannabis side. Obviously, we would take psilocybin clients right now, but the majority of our clients at the moment are hemp, just because that FDA is coming and they're freaking out. And I don't blame them at all. So we're trying to get them in compliance so that they feel comfortable, um, y- you know, having regulators in. So
You,
that's kind of where we're at right now.
Yeah, no, hey, you're a woman on a mission, and there have been some pandemic pros that have come out of this, and working remote, the flexibility of, all that kind of stuff, and being closer with your family. There's good things that have come out of this. And I want to ask you, you're one of the only guests that have said that FDA regulation's coming. So I haven't heard that. I mean, and I know that you don't know like the exact date or whatever, but like, what is your prediction as to when that's coming down the pipeline?
Well, they told me a year ago that they would have them out in 3 months. And then they told me 6 months ago that it would be 6 months. So we have no idea. In fact, Trump did sign off on a set of regulations. He actually rejected them, I think, because they weren't really specific enough or something. So the FDA is writing them right now. In fact, many of the things that I expressed during those meetings, and I've written a lot of public comment, and I've done a lot of stuff to like make them aware of all the issues that we ran into to try to help them write those regulations. But once again, I think that the FDA is just going to be okay. They're going to be like, we already have supplement and food ingredient regulations, right? So they'll probably choose one or the other to
Right.
go with and say
Right.
you have to be compliant with 111 or 117. And this mini chapter that is specific to the hemp industry, because there's certain things, nuances that they're going to have to address, but I don't think they have to rewrite an entire chapter. Like, you know what I mean? Like, they just need to be like, okay, these are the things, like equipment cleaning, as we've ran into, and dealing with the botulism issue, and dealing with, you can't drag your plants across floors and then shake them off. Like, there's got to be some kind of good manufacturing practices for all that to cut down on contamination. And the pesticide thing is really big, and the potency thing is really big. And so they're going to have to address those things as well. But
Right.
we'll see. I honestly have no idea. I've called and called, and they're like, we still don't know, because COVID slowed them down too.
Sure.
So
Sure.
yeah.
No, I mean, hey, it's encouraging to hear at least that it's top of mind for them, right? Because man, there's so many operators that are just begging for some type of regulation so that it's an even playing field. Because as we talked earlier, a lot of the bad actors are the ones that are benefiting right now due to snake oil, best practice, or ignoring best practices when it comes to cleaning equipment and other things, and it's a detriment, to the industry overall. So it's good to hear that that's in the works. So to wrap things up, Kim, I want to ask you, in the new year, we're now operating under a Biden administration, and we have seen clearly that the blue wave has hit. It looks like the Senate will be run by the Democrats. So what is your prediction in 2021 for cannabis as a whole, and in terms of your specific field when it comes to compliance?
So I think it's going to be great. Because as you said, so many people are going, just give us a set of regulations. We just want to know what we're supposed to do. And when it comes to food safety and public health, unless your state or local health department is regulating you, you don't have a set of regulations. And that's why clients hire us, because we come in and give them a set of regulations, and we tell them what they need to do, in order to be compliant with FDA regulation, even though they're not regulating right now. But they will be, guaranteed that they will be.
They definitely will be. Yes.
They definitely will be. So I'm really excited for the Biden administration, especially now that the Senate has turned, because we could potentially get the decriminalization. We could get safe banking. We could, and I don't know if it's going to be federally legalized. And when I talk about federal legalization, everyone thinks like, oh, if we federally legalize, everyone in the entire country can just walk out their door and smoke a joint. Definitely not true. It will be the same as liquor laws, where each state is going to decide what their laws are. So it'll still be very weird and divided. And some states like Idaho, for instance, who hates cannabis so much, they probably will never legalize cannabis. I wouldn't be surprised if they didn't for a very long time.
I didn't realize they were so opposed. I didn't realize that Idaho had that stance. I wonder why.
So yeah, Idaho are the ones that, I mean, you can't even sell a supplement, a CBD supplement that states, full spectrum, because full spectrum says THC is in it.
Has THC. Yeah. Wow.
Very small amount, but still, no THC is allowed in Idaho. In fact, people have driven hemp plants that are 100% legal across its borders from one state to another and been pulled over and put in handcuffs and arrested and kept overnight. Like it's crazy.
They just want to keep their potatoes, I guess. I don't know what that's.
I guess. Yeah. I don't know why it's so weird, but yeah, they're a very conservative state. And there's other states too, that aren't really down with it. And there's nothing we can do about that.
I'm in Texas, so yeah, I mean, Texas is a prime example. They're opening up a little bit in terms of like CBDs everywhere. And they have it's a poor medical program that we have now. We're hoping that we can expand this as the Texas legislature meets next week. But yeah, no, I hear what you're saying. It's all at the pace of what the states want to do and what they feel comfortable with, right?
Yes. So, I mean, in certain states, you can't buy liquor on Sundays. Every state has their own set of laws, and that's exactly the way it's going to be. But those companies that are, those states that are legalized, their facilities will still have to be under FDA and OSHA as well. So it'll just like increase the amount of regulation that they have, which is a good thing and a bad thing. It's going to happen no matter what. You got to kind of face the reality and just be ready for it. But I would say 90% of hemp and THC cannabis companies that I do one-time audits at are like way out of compliance for OSHA and FDA. And those are the two highest fining government agencies in the world. I mean, I've literally seen OSHA officers show up to a place for 5 minutes and write $100,000 fine and just walk out. And it's scary because that's what puts you out of business. Like that's the value that our company brings is we come in, we help you get everything under control, and then we leave. And then you should be able to walk on your own and do all this and be compliant and know what you need to do. We are here to train your company to be compliant. And then if you need anything, you can call us. But we're hoping that if somebody shows up, it's not the end of the world. It won't ruin your business. You might have a few things you have to change, which is every auditor, is going to be like, oh, I see this, change this. Small, minor things. Okay. But when it's like a huge, huge thing that could cause a fine, that's what we're trying to prevent.
Yeah. It hammers home the importance of the work that y'all are doing at Allay Consulting because of the current state that we're in, where there's a lack of regulation, specifically on the hemp side, right? But as you said, and as I agreed with, that regulation's coming. It's not a matter of if, it's a matter of when. So it's important for these operators to get ahead of the compliance issues and to operate the right way so that they're not having to deal with all that bullshit down the road, right? So, Kim, where can people find y'all's website, social media, if they wanted to learn more about the services that you provide?
Yeah, definitely. So our website is www.allay, ALLAY, consulting.com. Everything that we have is on that site. You can reach out. We even have a news page with all the articles that I've written and things like this that I've been a part of. Other than that, you can email me directly at Kim.Stuck, STUCK @allayconsulting.com. I answer. We also have a director of sales that I can forward your stuff to if I can't get to it right away. But yeah, we deal with your state regulations. If you're a THC cannabis facility, we do FDA, OSHA, Fire Code, GMP certification, and ISO certification, and now organic certification. So whatever you guys need, we're here for you. And whatever your compliance goals are for 2021, we actually hired a couple of consultants over COVID, which was kind of a crazy move, but we definitely are taking on new clients right now. We hate it when we're on a wait list, so I decided just to hire.
Well, you heard it first from the compliance queen, Kim Stuck. Thank you so much for your time today. And I didn't realize I was pronouncing it wrong. It's Allay, not
Allay, yeah. So
LA.
it actually means to calm or soothe stress and anxiety.
There you go.
Yeah,
Well,
it's an English word. So
we all need to allay this weekend after the crazy week we've had. So, well,
yes, definitely.
Kim, thank you so much for your time. I know that the audience really got a lot out of it from the compliance perspective, and like I said, we don't talk a lot about this often. So as the industry evolves, I'd love to have you on as a regular guest to share more insights as the industry becomes more mature.
Absolutely, anytime.
Awesome. Well, thank you so much again, and thank you all for listening. Bye.